So in this video, we're showing you some basic instructions that you can use in Navajo to direct elderly how to, or where to go if you're a triage nurse or a triage nursing assistant. So if you're greeting yourself, you can say, is it Dinék'ehjí nishle? I am a nurse, is it Dinék'ehjí nishle? Or if you're a nursing assistant, you can say, Aide, is it Dinék'ehjí nishle? So these are the phrases that are going to be covered in this video that you can use for an elderly patient. Hago, come here. Hago. Ya'ate, hello. Ya'ate. She'e eze Dinék'ehjí nishle. I am a nurse. She'e eze Dinék'ehjí nishle. She'e eze Dinék'ehjí nishle. She'e eze Dinék'ehjí nishle. I am a nursing assistant. Now with this next question, this is where you would put your name if you were to say, are you so-and-so? This comes in terms of patient identifiers. Nish so-and-so yindliye. Another patient identifier, to double check their birth date, you would say, Dequigo yolkalien dash nidishche. Dequigo yolkalien dash nidishche. Eirotago. Or, what is your chart number? Cha'at-ish nenaltzos be'eho zinigi. Cha'at-ish nenaltzos be'eho zinigi. And if they identify, you can just say Hagoshi. Okay then. To say I'm going to check your weight first, you would say Altse aniltasigi nabitnesh'a. Altse aniltasigi nabitnesh'a. If you want to say stand right here, you'd say Ta'akwe yizi. Ta'akwe yizi. And if you want to tell them to come into a room, you would say Akonne yahanana. Akonne yahanana. It means come right in here. If you want to say sit right here, you'd say Ta'akwe dahanta. Ta'akwe dahanta. But you have to indicate that you're sitting down. To say I'm going to check your blood pressure, you will say Qad nidilna al-kidigi nabitnesh'a. Qad nidilna al-kidigi nabitnesh'a. If you're going to say I'm going to check your temperature, you can say Qad nitz'is sadohagi nabitnesh'a. Qad nitz'is sadohagi nabitnesh'a. From there, a lot of questions are give and take. So if you don't speak Navajo, the best thing to say is Qad atcha'achalne'e hago b'dideshnil. Qad atcha'achalne'e hago b'dideshnil. I'm going to call the interpreter. If you want to tell the patient to sit in the waiting room, you will say Na'iz tchanekone dahnanda. Na'iz tchanekone dahnanda. Because usually as a triage nurse, you'll take their vitals and then you'll have them sit out again. If you want to say wait right here for the doctor, you'd say Akwe eze il'ine baba'senda. Akwe eze il'ine baba'senda. Another useful phrase to say is Altse adilchahakache dilna adolnil. Altse adilchahakache dilna adolnil. Which means first, lab will take a blood sample. Then to direct them there, you would say Akondenahya. Akondenahya. Can you head over there? Now next, we're going to show you a live demonstration of all of these phrases at play. Ernestine Sandoval, Hago. Yahanana. Altsen dasgina bitnesha. Crazy. Aro akone yahanana. Nish Ernestine yindliye. Dequigo yolkale dash nidishche.
December 30th, 1983.
Nice. She's all laughing. Eirotago ha'at-ish nenaltzos be'eho zinigi.
555.5.
John. Hagoshi. Qad nidilna al-kidigi nabitnesh'a.
Kanitsi Sadoagi Napinesh at Hahalne Hagobideshni. Na is Tanagoneta Nanta Agwe is a in a Babasanda. Also a Dilhahakache, Dilna Dornil. If you're ever caught and you can't say anything, say Dinék'ehjí dodis ada. Also at Hahalne Hago Bideshni. So anytime you get stuck, say that. Dinék'ehjí dodis ada. Also at Hahalne Hago Bideshni.
One last time, if you want to learn some advanced phrases to say before you get seen, I'm going to check your blood pressure and your weight. You would say T'ato nitnel ego nitil na alkirigi do anil dasigi na bitnesh. This is to let them know that you're going to screen them first or triage them. If you want to say I don't understand Navajo, you say Dinék'ehjí dodis tsata. Dinék'ehjí dodis tsata. So to say I'm going to call the interpreter, you say Ako atchahalne hago bidedeshni. Ako atchahalne hago bidedeshni.
And that's basically simple phrases that you can use, simple commands to guide an elderly Navajo patient through the triage system. Yeah, thank you. Okay. Okay, it's still right? Okay.
Bloopers.